Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I talk to the who's who of health tech and healthcare innovation. And today we are diving into the issue of workplace safety in health systems. And we're going to meet a tech company that's got a very promising solution to this problem. So please join me in welcoming Shan Sinha. He is the co-founder and CEO of Canopy. And Canopy has been in the market for 4 years, being sold underneath a white label. They've just busted out from the white label. They're selling direct now, and they're launching a brand new product called Canopy Protect. So Shan, excited to talk to you about all this stuff.
Hi, Jess. Thanks a lot for having me. I'm excited to be here.
Yeah, lots of stuff to unpack in this story. So you guys,
Yeah.
like I said, have been around for 4 years. So in what you've developed is this really cool technology that's being used by somewhere up from 200,000 different hospital staffers in this 4 years. So why don't you start out there and describe the technology, and then we'll talk a little bit about how the business model around selling it is changing. But tell us about the tech. Like, what exactly is this that we're talking about here?
Yeah, no, I appreciate the question. We've been working for the last 4 years on creating a solution that helps hospitals protect their workers. Most people in general may not be fully familiar with how big of a problem safety is for healthcare staff. If you talk to nurses, if you talk to clinicians, what you'll learn very quickly is that most all people who work in hospitals have experienced issues where patients, patient families, patient advocates can tend to get aggressive and potentially even violent with staff, and it turns into a real problem for the people that are just trying to provide care to their patients. And so we ended up getting introduced to this problem about 4 years ago, working with a number of nurses, clinicians, healthcare leaders, and ended up figuring out a way to apply technology to help hospitals keep their workers a bit safer than what they were able to do over the course of the last couple of decades. So what we created was a portable wearable panic button that they can
Okay.
carry around with them on their scrubs. It looks something like this, very simple, streamlined. We've got a few new versions that we're going to be talking about here. Press the button, works with a set of sensors that we connect in the hospital, and with all of that technology and the cloud services that power it, they can essentially signal for help if things are starting to get out of control or if they're feeling threatened. And when they do, within seconds, we we can identify who the individual is that needs help, their precise location inside the hospital, and their coworkers and central security can mobilize to help respond and lend a hand. And so we've been
That's
doing this
really
for the last
cool.
4 years, and we've been seeing lots of really great results in our ability to help people around the country.
All right, let's go a little deeper. I love this personal panic button, and I love when people show me the device. Like, that was awesome. So thanks for sharing that. So the idea is that any individual staffer would have this on. If something goes awry, they're getting yelled at, somebody's kicking, screaming. There's like a situation that's occurring, and they need help. They hit the button, and then how does that work? Like, I mean, because there is a lot of stuff in a hospital, right? And a lot of times there's thick walls. How does that work? What can you tell us about that signal and how it carries through and how it alerts somebody who can come and help?
Yeah, it turns out hospitals are really complicated environments, and one of the key things to being able to address or use technology to help support staff and nurses and clinicians whenever they're dealing with issues is something that can be deployed across an entire organization. Because if it only works in one part of an organization and not somewhere else, it's not something that you can depend on. It's sort of like being able to call 911.
Yeah.
If You don't need to use it that often, but when you do, it just needs to work. And so, one of the advantages that we've had, I didn't tell you a little bit about our background, but we're Silicon Valley technologists. We are outsiders to healthcare, but what we do know how to do is take new modern technology and apply it to problems that people face. And what we found was a way to use Bluetooth, Wi-Fi technologies. We take this button, which essentially uses Bluetooth, connect it to a whole bunch of sensors that look like smart plugs that are all installed all around the hospital, and combine that with a whole bunch of cloud services that we're all familiar with in our personal lives, and bring all that together into a system that works in any environment across an entire organization, and gives workers a way to be protected no matter where they are, mean, I'll give you a simple example.
Yeah.
If there's a nurse who happens to be in a room taking care of a patient starts getting aggressive or their family gets aggressive, if they happen to need to move or get out of the situation and flee, they can press their button. We will track, we'll be able to identify their location in real time so that a security officer can be dispatched to their exact location, help resolve situation, de-escalate things before anything actually gets out of control. And ultimately, what we find is that anybody who ends up wearing one of these ends up feeling, and we've done this in surveys, they end up feeling dramatically safer at work. And it helps them do a better job of caring for their patients.
Absolutely. And I mean, the pervasiveness of this problem, which is getting worse post-COVID. I mean, we can talk a little bit about that, but I mean, one of the statistics I read is healthcare workers are 5 times more likely to experience workplace violence than any other kind of worker. And there was a stat, and this was a pre-COVID stat from before from before COVID. 1 in 4 nurses experiences like a workplace violence issue. Like, I mean, that's crazy to me that it's that pervasive. What have you guys found? Because I mean, you've been tracking this for 4 years now. Like, what can you tell us about what you know having your device on different people?
Yeah, it's amazing that this is a problem that is as pervasive as it is, and it's sad. At the end of the day, the people that are trying to care for their patients have gotten to a point where they feel like dealing with this kind of aggression and violence is just a part of their everyday jobs. Like it's part of their job responsibilities, and I think that's the thing that's the most um, depressing or disappointing about how big of a problem this is. And so, you're exactly right, Jess. The over the last handful of years, OSHA, federal organization around workplace safety, has been monitoring all of the filings that come across all industries, not just healthcare. And it turns out one of their top 5 issues is workplace safety. But if you look into that data, out of all of the filings that OSHA gets, 75% of those filings around workplace safety come out of healthcare. It is remarkable
75.
how
Wow.
75%. It is dramatic. It is a dramatically high number for an industry that is so critical to our everyday lives. Out of the over the last 18 months, we've been looking at all of the data that we've been collecting. One of the advantages that systems that our health system customers get is because it's real time, because it's cloud based, we have a whole bunch of data on what kind of incidents organizations are dealing with, how often they're dealing with them. And if you look at all of the data that we've looked at, over the last 18 months, what we have found is that nurses tend to be involved. 15% of nurses end up being involved in an incident that is severe enough for security to be involved every single year. And
Wow.
it's a very large number. So what that essentially means is 1 in 6 nurses is experiencing an incident every single year. And that is a really high number. And if you're a nurse and you are, every day just trying to take care of your patients, even if you haven't experienced an incident, one of your immediate coworkers has. And it is
Yeah.
that pervasive a problem. If you talk to any nurse, anybody who you know who's working in healthcare, they are going to be familiar with this problem. And I'll be honest, that was a big surprise to us when we first got into this four
Yeah.
years ago. And it feels great to hopefully play a small part in helping them feel safer when they go to work every day.
Yeah, I mean, that's incredibly scary, like that it's that pervasive. I want to ask you a little bit about the data that you guys have access to since you brought it up, Sean. So what can you tell us about about what that looks like even for like that if you guys, I mean, like you said, you guys are like already installed in 30 different health systems. So that includes
That's
like
right.
the offices, the hospitals, like all of it, 30 different systems. So, what does it look like from the health system standpoint? Because I'm sure I have a more than one risk manager who's got their eyebrow raised and is leaning in to hear, what does that look like? What do they get to see if they're on that receiving end of the call, and in aggregate over a period of time? What can you share with us about that?
Yeah, so the way that our system works is actually very, very simple. What we've constructed is an end-to-end product, and this is some of the experience that we have that we've developed over the course of our careers in Silicon Valley. But what we've created is an end-to-end product that's delivered as a service, and so we will do all the things that a system needs to help incorporate this and deploy this across your entire organization, When you do, or when an organization does that, they'll give every single individual one of these buttons. It's personally assigned to that person, so they can take it with them. They can leave it in their locker whenever they come in for their shifts. We install all of these for the customers. We monitor the system 24/7, 365 days a year. It always stays up 100% of the time. And when somebody presses the button, what ends up happening is a few different things. Number one, central security, who is monitoring a special console for incidents, will be watching the system and looking for incidents, and that incident will appear to them within a matter of seconds. They have the ability to go figure out what might be going on. Typically, what our customers do is they dispatch an officer right away to go and assist. At the same time, we're able to determine who might be nearby and in a position to help. And so, what we tend to do is encourage customers to signal for help right as they sense that things might be going sideways. And when that happens, nearby coworkers can drop in, lend a hand, and just step in and ask if everything is okay. I'll tell you a story about one of the systems that we're working with. One of their hospitals happened to be a hospital uh, where they were predominantly serving patients that were in the nearby prison, and so there were a number of individuals that were under care, and someone decided to flee. And there was a weapon involved and all sorts of other
Wow.
sorts of situations. And these are the types of situations that staff have to encounter uh, just in the course of doing their jobs every day. And the tools that they had in place before to even address this were unfortunately inadequate to address the scope of the problem that we're dealing with now.
Say a little bit more about that because, like, I mean, I have no idea, like, other than like training staff on, like, how to diffuse situations or, active shooter drills, like the behavioral training component of that. What else is in place? I mean, like, what kind of technology? Like, I think of hospitals I've been to, I think of like the closed circuit TV. There's like one central panic button underneath the desk in the nurse's station, but nothing in the rooms. Like, what is the status quo, Sean, of like how hospitals and health systems are dealing with workplace violence? Like, what happens now? Like, what's the gold standard?
Yeah, and the sad thing is, I think because the current status quo uh, wasn't really designed to address this problem as well as it really needed to be. I think that's
Mhm.
part of the reason why healthcare workers have generally assumed that this is just part of the jobs, and our view is it doesn't have to be. And so, what does that look like? Well, the options that they've generally had, like you're saying, typically have fallen into people in process. It's training, it's more security staff, it's more surveillance. And it turns out those aren't really the best ways to address these problems. And I'll tell you a story. So for example, during the pandemic, there was a huge surge in patients that showed up in hospitals. We even looked at the data, and it turns out during COVID surges, what we tend to see is a 10 to 12% increase in the number of incidents that happen. And so, why is that? Well, there's a number of reasons. Your nurse or your technician or your clinician might be taking care of a patient, but during COVID, the door happens to be closed. Nobody can hear them. An incident happens. How do they signal for help? The closest thing they have might be the nurse call button, which is a wired device on the other side of the wall designed for patients to ask for help. But you might be pinned in a corner and you can't actually reach it. You can't yell out for help. That's the state of the art. There have been some technologies that have attempted to create duress buttons. Most of them are using outdated technology
Mhm.
from 2 decades ago. There really have not been modern technology based approaches like what we have developed over the last few years. And that's part of the reason why we were in stealth for the last 4 years. Was the problem is not just a matter of creating technology, it's about working with systems to work within and with and complement all of the processes that they have in place to deal with these types of situations, because they're very varied. There's a lot of stakeholders involved, and the most of all is the staff, but there's a lot of other folks involved. And I think we've done a very very good job of partnering with systems to create something that actually works for them.
I want to find out more about that, but before I do, I want to ask about some of the product innovations that you guys are coming out with, now today, as part of Canopy Protect. So let's talk a little bit about that, because like one of my favorites is how this works not just inside like the four walls of a facility, but it works outside, like in a parking garage or a parking lot, or even in a parking garage. As far as like, this was impressive to me, 10 levels down. Like that's amazing. And like I also like the 15 years between battery charges. I mean, this is pretty simple. And I'm going to add in one other thing here, and it's not necessarily a product innovation, but the word affordable was layered into this. So, what can you
Yeah.
tell us about some of these innovations, and then how affordable is affordable, Sean?
Yeah. No, that's part of why I think we've been able to be as successful as we have. And like I said, we've been really heads down focused on building a solution that works. And so there's a number of innovations that are coming right around the corner here with our launch here. So Canopy Protect is a new product that we're rolling out that is going to be available directly from us. As part of that product, we're introducing a whole new set of capabilities. Up until now, our product has been used and deployed primarily to protect workers in indoor locations. So you imagine, 10, 20 floor buildings, lots of different units and places where patients are being taken care of, but it's all been indoors. What we know is that there is a large number of incidents that happen on the way into work and on the way back home when you're leaving work. That might be in parking lots, parking garages. We've heard this from a number of customers that this is one of the biggest areas where they don't have the ability to know that an incident might be happening and a place where they can send help. And so one of the biggest innovations that Canopy Protect is going to be released with is a fully comprehensive way for individuals to carry the same buttons, but gives hospitals the ability to extend coverage not just to indoor locations, but also to outdoor locations like parking garages and parking lots. We're taking advantage of a whole set of new technologies that allow for signals and radio waves to move through parking lots and parking garages, through concrete and steel, and it'll allow hospitals to extend coverage all the way down to, like you were saying, 10 floors underground. At the same time, we're also rolling out some new form factors for staff to be able to carry their portable panic buttons. So this button itself, this is going to have a 15-year battery life, so they can just wear it and forget about it. One of the things that we always think about for 15 years, and one of the things that's really remarkable about that is, at the end of the day, the system has to be simple enough so that anybody can use it at any time. They don't want to have to think about the technology. And part of having a battery life that lasts that long is that you can just pick it up and you can know that it's going to work. One of the other form factors that we're rolling out is going to be something that looks like this. So every healthcare staff person typically has a badge or an ID card. You can just slip their ID card right into a device like this. There's little holders for it, and there's a button on the back. And one of the real design kind of challenges that we have is for the button to be discrete. You don't want to escalate a situation unnecessarily, and so by making it discrete, silent, it's something that staff or a nurse or a technician can press the button and signal for help. Somebody can come and assist without the patient necessarily being triggered by any sort of kind of issue that's going to cause things to escalate. And then finally, yeah, no, and I think it's one of the most important things that we've been able to do, which is work directly hand in hand with nurses and clinicians to create a form factor that's going to work for them every day. And I mean, you have to remember, this is an everyday sort of device that's there to help them feel safer at work. You mentioned affordability. Absolutely, it is critical because of one simple thing. When an organization is keen to protect their staff, they need to be able to protect them everywhere. One of the biggest challenges with any of the technology that existed that even attempted to address this problem was that it was way too expensive to deploy in more than 10% of your organization.
Right.
Of the 30 systems that we're working with, nearly all of them are keen to roll our system out across every aspect at every location in their facilities. And so that includes multiple hospitals, that includes their parking lots, that includes ambulatory clinics, that includes outpatient clinics. And so we've designed the system to be affordable enough so that every single individual and organization can be protected.
I love that. I think that's so great. I mean, because there's a lot of staff. There's a lot of staff to take care of, and they're
That's
big
right.
areas too to cover. So that's really interesting. I love that. I like the innovation that goes into even making that affordable. I think that's really great. All right, so now you guys are not in white label stealth anymore. You've come out here as Canopy, and talk a little bit about that. I mean, you keep saying all along, and you can really get a sense that you guys have worked for the last 4 years really closely with your customers, but now going direct in terms of selling to them, this gets you even more face time. So say a little bit about the decision to go direct, because oftentimes when it comes to technology companies and their business model, it's like a lot of times they start the opposite way where they go direct first and then decide to white label, but this is a little unique. So what precipitated this decision?
Yeah, it's a really good question. It is very unique. And I think, one of the advantages that we've had just having been around Silicon Valley and creating companies for as long as we have, you can figure out which rules, you can break and which rules you can't, but once you've actually followed those rules for a little while. And, I think one of the things that we learned going through this is, you know, health systems are very, very large organizations and they're complex, and the processes that they have in place are very they're very varied as you go from one organization to
Ugh,
another. And in order for technology to be successful, I mean, technology is a bad word in healthcare, because how many times are systems deploying technologies that end up not working or being overly complicated or over budget? And one of the things that we really felt like we were able to learn over the last 4 years is not just how to build the product, but how do you actually get this to work? How do you deal with the fact that an organization that might have 30,000 people, they're hiring 1,000 people a week. They're turning over 1,000 people a week. And ultimately, this is about supporting the organizations to keep their people safe. And if the technology can't be brought into an organization, it's not going to be successful. And so over the last 4 years, I think what we would attribute our success to is how closely we were able to work with customers to get to the point that we have. And I think what we've learned over the last, and we're very fortunate to have worked with some really wonderful partners in that process. But what we learned over the last couple of years was that that I think we lost a bit of the ability as we've grown and scaled to maintain that relationship with
mm,
customers that has really steered us toward building things in the way that makes sense for them. And so our mission is to protect and empower every single one of the 6 million workers in the country and the tens of millions around the world. And so, in order to do that and accelerate our vision and our goal to do that, we believe that working directly with our customers and kind of returning back to where we got started is going to be the most effective way to do that. And so, with the launch of Canopy Protect, we're also shifting our model to just go sell directly to customers and wind down our white label business that we've been doing, and we've been very successful with, and been fortunate enough to work with some really wonderful partners.
I'll say successful. You guys are profitable, and you have yet to take on any type of venture or funding. So let's talk about how maybe this changes that too, Sean. Let's get into this.
Yeah,
'Cause
yeah, Jess, that's
yeah, I mean, like this requires now a sales staff, a robust marketing budget. You should probably sponsor the local interview show. Like, I mean, there's a lot of things that come with selling direct, in terms of creating awareness. So let's talk about that for a second from the business standpoint. Because, like I said, you guys have been profitable. I mean, a lot of times people are like, if it's not broke, don't fix it. And so now you're changing everything. And you have not taken any additional funding to date. Like, does that change too, Sean? I mean, you are in Silicon Valley. We keep hearing about it. So, so do you go that direction now? What can you tell us about that?
yeah, it's a good question. I've been fortunate enough to raise a lot of money in my career, both directly and indirectly. I've been
And
involved
so you're
in
qualified too
various.
to do this.
So yeah, there's very small amounts of money and large amounts of money, and so yeah, you're right. I mean, there's a formula for building Silicon Valley companies, and I think if you look at a number of successful companies, it turns out that doesn't have to be the way to do it. And I think from our point of view, it's a deliberate decision to not raise outside capital. It might make sense to consider doing that at some point. We're not in a need to do that. Like I said, we are profitable, and I think we have the ability to grow without raising up outside capital. But there's a real reason, and there's some deliberate thinking behind that, and it boils down to one simple thing. I think as soon as you raise outside capital, there's a whole set of forces that pulls you away from focusing on your customer and building the product that they need. It oftentimes turns into grow, 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 because ultimately the goal is to generate a return for those investors. I think we've been lucky enough to just focus on building a great product, partnering with health systems, and I think we'll consider raising money when we don't imagine that ability is going to be at risk, and we'll consider it then if we need to. And so that's basically the thought process, and we're fortunate enough to be in a position where we get to A, make that choice, and B, if we wanted to raise capital, we could. And so we're being very deliberate about that.
Love that, Shan, but I feel like a whole bunch of healthcare system executives' hearts just broke a little bit because they're like, "Oh man, I want in on the ground floor on this."
What I'll say, Jess, is we've seen a lot of companies. I think you're seeing some of that happening. We're seeing a lot of companies right now kind of struggle with some of the challenges of having raised a
Oh,
lot of capital,
absolutely.
particularly in healthcare right now. And so, what we want health systems to know is that we're building a company for long-term sustainability, and we're going to be a partner that's around to help address what we believe is a really critical problem to core infrastructure in the country. And so,
Yeah.
our goal is for our customers to know that we're not going anywhere, and our focus is on serving them as well as we possibly can.
All right, we'll leave it there on that one. The final words from you, Shan, on what's directly ahead. So you're launching Canopy Protect, you're building relationships directly with your customers, and then like, what is the rest of what is the rest of this year, 2023, and what does the beginning of 24 look like for you guys? What do you have on tap?
Well, the big focus is just like you're saying, we're launching Canopy and Canopy Protect coming out of stealth. A company that most people have never heard of. We're planning to roll out a whole set of product innovations over the course of this year, and we're aggressively growing our team. We need to bring on folks across a lot of different roles, and I think that's a little bit of a unique thing these days in startup land. And I think there's a lot of opportunity for us to continue to innovate and come up with new capabilities. And so we're going to basically be focused on building products, growing our team, and trying to accelerate in our mission towards protecting and empowering people all around the country, in hospitals
Awesome.
everywhere.
Awesome. I love it. Well, thank you. Keep on keeping on. This is this is such a good the good problem to tackle. I mean, we don't often hear enough about protecting healthcare workers and helping make sure that they feel safe when they're delivering their jobs. And this has really skyrocketed in terms of the number of incidents that have been reported. And so it's great that you guys are tackling this, and exciting now that you are, under your own moniker doing it. So congratulations on that. Thank you so much for stopping by.
Well, thanks a lot for taking the time to chat with me, Jess. I
Oh,
really
yeah, it's a
enjoyed it.
pleasure. Absolute pleasure. Call you can come back when you raise your Series A. No, I'm joking. No pressure. No pressure. No, I'm not even gonna put that out there. All right. Thanks so much, Shan. If you want to hear more from those who are changing the way that we do healthcare, you can head on over to my YouTube channel. It's youtube.com/WTF Health. Hit subscribe while you're there. Check out a few more interviews. Thanks so much for joining us. I'm Jessica DeMatha. We'll talk to you guys real soon. Take care.